everyone, welcome back to Eggplants and Peaches podcast. As you know, this podcast is brought to you by Melbourne-based non-for-profit volunteer organisation, Global Health Youth Connecting, which is associated with the University of Melbourne.
As always, we want to acknowledge that the University of Melbourne City campus is located on the land of the Wurundjeri people of the Kulin Nation. We acknowledge their elders, past, present and emerging, and welcome any First Nations listeners to the podcast.
To ask us a question or suggest a topic for us to discuss by following our Instagram and Facebook account, or send us an email at sexualhealth.adolescent.health@ghYC.org.au. All links will be available in the description box below as always, or alternatively, you're welcome to leave a query in the comment section.
We hope this podcast series not only provides a safe space to discuss sensitive topics, but also raises awareness and empowers youth to be allies in this space. We would like to warn our listeners that we may discuss sensitive and triggering content such as mental health and sexual assault. Resources will be provided for those that may need to seek help or advice from professionals and organisation, as always in the description box below.
Hi everyone, it's Grace here from the Peaches and Eggplants podcast, and today I have the pleasure to chat with Dr Siobhan Bourke, who is a senior lecturer at the Centre for Excellence in Rural Sexual Health, as well as being a sexual health physician who has worked in education for almost 20 years. Siobhan specialises in providing training to health professionals and medical students on sexual health care and sensitive physical examinations, and has a particular interest in contraception, unplanned pregnancy, and adolescent sexual health care. We're so excited to have you with us today. Thank you, Dr. Bourke, for taking the time to have this chat.
Thanks, Grace. No problem at all. Please call me Siobhan.
Yes. Yes. Oh, I'm so used to doctor. It makes me very excited.
Yeah. You can say Dr. Siobhan then if you need to.
Thank you. So I guess to kick off the chat today, I'm really interested in what are the primary issues for adolescent sexual health in rural contexts? And is this different to what you see in an urban setting?
I think some of a lot of the issues in a rural context are pretty similar to urban, but they're probably a little bit more stressful or exaggerated or possibly, just a little bit harder to deal with. So if we sort of take away the things that are common to both of them, so getting, negotiating sexual activity, negotiating safe sex, contraception, all those sorts of things, which can be, more difficult when you're not as well informed as you should be, or you're a bit nervous about doing it, you're developing your emotional maturity, all those sorts of things. And if we think about the things that are sort of more emphasised, I suppose, in rural communities, it's things like access. And those access things can be not only can I find the GP or the medical centre that I like to go to, that are welcoming to me and that I feel safe and I have trusted relationships, but it can also just be simply getting there. You may live in a small town and you might jump on a bus to go to school and you're expected to jump on the bus and come back home from school when the bus is going, and not to hang around in a bigger town, potentially so you can go to the doctor or the sexual health nurse or practitioner nurses. And so that can actually be more difficult. Now, there are a lot of parents and guardians and carers who are completely fine with this, and kids have great relationships with and are able to discuss with them, and therefore the transportation and the access to the clinics that they like are not an issue. But there are also a significant number of, young people who don't have those supports. And so therefore, just from a simple access, can you get the right to see the right person? Can you actually physically get there? What are the payment issues? My Medicare card is in, my mum or dad or my guardian's wallet. How do I access that? All those sorts of things can become quite scary. There's also the big wide world of the internet, which we're on at the moment probably, but it's getting the right resources, getting getting, trusted information and where you get that from. And I think, the biggest things, which I've sort of alluded to with the people who have good relationships with their parents or guardians, but it's also good relationships with your friends, being able to trust your friends, support your friends, make sure everyone knows where everybody is at a particular time and maintaining safety. And then also just being able to get support from your friends, maybe to access medical care, or, how do you buy condoms in a country pharmacy when your aunt's the one who is the pharmacist, or just the person who's, works in the pharmacy assistant. So you have to think about all those sorts of things that can be slightly more heightened or more complicated.
Yeah.
And so there might be a lot more, well, I'm doing this for a friend, and, whether they're doing it for themselves or the friend, that's, as adults, hopefully, who are helping young kids out negotiate this sort of stuff, we, can sometimes let those, I'm doing it for a friend slide because somebody is getting protection or getting a good bit of information, etc.
Yeah, absolutely.
Does that kind of cover it?
There were so many broad things that you touched on there that are really important, and one that connected very strongly with me. So when I was in the end of the last 3 years of my high schooling, I lived on a 160-acre property outside of Lancefield. And, that was literally impossible for me to get anywhere. You don't get your Ps until you're 18 in Victoria. Yeah. So you can't drive yourself anywhere. Your friends potentially can't drive you anywhere if you don't have older friends or siblings that can help you out. And obviously being on a farm too, that meant I couldn't work. I didn't have a job. So I didn't have my own money to be able to then go to a doctor. And if I wanted to access some resources, contraception or any abortion, medical abortion, anything that, hovering over you, knowing that you had those restrictions. So I'm really curious about young people today. Is telehealth, has that improved access for young people to sexual and reproductive health services in rural areas?
Well, it's relatively new. There have been some services and projects being, set up over years, which have had some sort of success in being able to have, testing or something done, and you have a little consultation and you can get samples sent to you, and, then you send them back and whatever. I mean, those things have their own complications as well if you're receiving mail. I think it's probably I think there's very few, but one of the silver linings of the COVID pandemic has been that telehealth, which is both video, so when you say telehealth, they're sort of meaning that you're having a video consultation, and then there's telephone health, so you're actually on the phone and you're not being able to see the person. So I know within my practice, which is out of Western Melbourne, but I do have people come in to see me from the, the surrounds, I guess the urban-rural interface. And I know that the telehealth has really assisted being able to do some of the general checks and things just over the phone instead of, getting into the car and driving for an hour. And then, most of my clients, not all my clients, but most of my clients are of driving age. And, just being able to do some follow-up conversations over the phone without packing kids and babies and stuff into a car for a 10-minute consultation with me where, we could have done most of it over the phone. So we do have, when we have face-to-face discussions, we do talk about we can do this on the phone, but there might be a reason that I say you need to come in and see me. So it has really, in that way, opened up some of the things. Most young people, not all young people, but most young people have a phone or some way of connecting. So at least it's not like you're like I used to be on the phone and, hiding in the linen closet is where we used to take my personal calls. And I too, grew up on a farm, and so it had all the things that you were talking about as pressures on me. But I think the access to doctors, and I'd say this is probably just for all healthcare, that it has actually made it a bit more simple for, a lot of people, including young people, anybody who has access to a phone. It's still not an easy thing to kind of set up if it's the first time that you've got to set it up, because traditionally people don't go, I'm going to the doctor, I'll just nick out onto my phone. But, you know, I think it'll be interesting to see the statistics on it as to who's really using telehealth. I bet you it's more older people than younger people, but when we do get the statistics in the next few years over that will be interesting to see.
Yeah, absolutely.
I mean, sorry to interrupt, guys, but one of the, you know, if young people aren't used to seeing the doctor, talking to the doctor on the phone, it's more difficult to set up a relationship. If you can have videos, obviously that can make it easier, because at least you can see each other, because there's lots of cues. And the other thing is, you know, are they really private? So, you know, you can do video calls and say, can you show me around the room so that I know that you're by yourself? But that's not entirely, you know, I mean, we all know. Actually, I won't tell people how it is that you can do that, just in case they haven't worked it out. But, you know, there are ways, obviously, of videoing and not showing that someone else is in the room. So there are some cons to it, but yeah.
Yeah. On that point, on the privacy and confidentiality, because I think it is something for young people that's really important to them, how do healthcare professionals protect young people when they're seeking healthcare?
Well, there's surprisingly, people often think about this, but there is no age to confidentiality. There might be some consent issues to treatments, and people have to prove that they're consentable. And I can say people because this can be people of all ages depending on what their condition is. So if you've got an intellectual disability and you're 50, it doesn't mean you can automatically consent if you can't actually understand what the procedures are. And also the thing to know about consent is understanding the treatment, understanding not having the treatment. Okay, so if you think about, I want to go on the pill to prevent pregnancy, and somebody won't give you the pill because they say you're too young, you know, denying someone the pill is probably going to do the reverse. It's going to get them pregnant. So it's that understanding of having the treatment and not having the treatment is also, so it's good to kind of have the balance of two. But it's the confidentiality has no age limit. So you can go in at 10 and have a confidential conversation. You may not be consentable for any treatment. You need to get guardians in and parents and all that sort of stuff. But you can actually have a confidential conversation. And so too at the other end of life, which sometimes get ignored a fair bit, and people are like, oh no, it's not my grandmother's right. I need to know what's going on. Don't tell her. So I find that sort of very odd. But so everybody has the right to privacy and confidentiality, with the exceptions of, and this is what health professionals need to explain to. So to how a health practitioner should explain privacy and confidentiality to a young person, or anyone in fact, is that we all have the right to privacy and confidentiality when we're seeking or having a consultation with a medical practitioner, and that confidentiality is absolute except for a couple of reasons why you would break it, and that's associated with if you are going to do harm to yourself or harm is going to come to others, that then you can break the confidentiality. In particular with young people, I think it's really important to explain this up front. And I talk to, you know, I often get told, oh, but then they won't tell me everything that I need to know. And it's like, well, you need to develop a trusted relationship with someone to be able to really help them. And if you haven't told them that you have a couple of reasons why you break confidentiality, and then when they do tell you something that they're going to harm themselves or harm others, or harm's going to come to others, then you have to act on it, and that's a much harder conversation to have, and it's very difficult to come back and earn trust again if that's how you're going to do it. So maybe they're not going to trust you in the first consultation, but they might trust you after several, and know that you're there to assist them. But they do have the right to know what it is that they're coming into, so that they know they can modify how and what they tell you, knowing what kind of treatment that they're going to get. And people do it anyway. So, if I'm a sexual health physician and think that people haven't slightly bent the truth for me, then I'd be a bit silly not to recognise that. The other thing is that if I see young people, or when I see young people, I will often, and if they do come in with a parent or guardian, I always know who it is in the room. There's nothing worse than thinking that's somebody's mother, but it's actually their aunt or it's their caseworker or something. So everyone in the room should be identified, and then I will say that at some point I make sure that the person's okay with the other person being, so my client's okay or my patient's okay with someone else being in the room, and then I will ask them about, and then I'll say to the parent or guardian that there's probably a time in this consultation where I'll ask you to leave. Now, sometimes that's necessary or not, or the young person goes, no, mum knows everything or whatever, and so off you go. But I can still, even if I think mum knows everything, I can still ask her to leave, and at least I've set it up at the beginning. And the other thing is that if someone does leave and they come back in, I have a discussion about what it is you would like me to discuss again when you parent, guardian, whoever's back in the room. In saying that, also friends in the room are really useful. Like sometimes they can drive you a bit batty because they take over and you're like, no, I need to find it out from so-and-so, not from you. But often they remember everything and everybody knows everything. And then also if you're explaining some sort of method of contraception, they can help remembering. 3 brains are better than 1, to remember the rules of the pill, or the method of contraception that you're going to use, the pill not being my favourite. So, I'm all for friends coming in, but I will once again say that there could be a time when I need to see them by themselves or whatever, or I may ask you to leave, because sometimes they can just be distractors or they just take over with their own history. But friends and connections to family are the greatest protectors that all of us have. So it's really good for us to actually encourage that when we're seeing young people, and that can help. That can be a hindrance, or it can really help in the country or in rural places, because, as you were saying before, you can have the older sister drive you somewhere. You can both say you're going shopping, but you've actually got to go to the medical doctor, whatever. So
yeah, I can see that there must be a real tension for health professionals when we're trying to advocate for health autonomy, and you're trying to have that person realize the best health that they can, whilst also, realizing that people don't operate alone, that they are within their networks, and that we can really utilize our networks to support us to make really great health decisions, to reinforce that, when you go back out of the doctor's office, because that's where the real health, negotiations start.
Yeah, and it's a really interesting point you make, because of all the different types of medicine, sexual health most of the time involves at least another person that may or may not be in the room. And I think it's a really important thing to talk about, the fact that, most of my clients, I won't say all of them, but most of my clients are seeing me about something that involves other people, if that makes sense. Yeah. And I think one of the other things that's really important about particularly sexual health for young people is acknowledging the fact that all of us will have a sexual life, have a sexual career, I often say, but that it's fun. It's the reason that people get themselves, because people actually want to do it. But, we haven't empowered our young people enough with really good education, really open conversations and things. I mean, if you look around the world, the places who do the education and have sexual health, and it's acknowledged by society, most of the Scandinavian countries are, up there, and they just have lower rates of everything. People can access contraception over the counter. They can talk to their mum about when they should get it. They have lower rates of unplanned pregnancy, particularly in young people, and lower rates of STIs and stuff. So, if we can all talk about things and give that access, then our young people will be a lot better off, particularly in the country.
Yeah, absolutely. And I think what you're talking about there, where it's a whole societal shift, it's beyond just the healthcare professionals, but Australia as a society sort of sees young people being sexual as still a controversial thing, and something that maybe some people don't want to acknowledge, or would rather just go away, don't think about that until that person suddenly turns 18 and is, deemed by society to be allowed to make decisions. But we know that obviously young people making sexual decisions well before that age. So I'm curious about how, in your experience educating health professionals, what do you think are some of those things that might be holding health professionals back when it comes to engaging with young people about their sexual health?
Well, talking to people about the fact that medical students, nurses, whoever the medical practitioner had the same crap sexual health education as the rest of everybody. So if you think about young people being uninformed and not having great knowledge, that's the same for the medical students. They didn't grow up in some special area where everybody spoke about it. So they're all coming from a similar background. And the other thing is that we've been taught and, it's been embedded in our heads that we're all supposed to be fantastic at sex and know all the answers without actually having the education. So if you think about a young person asking their parent something about sex and they don't know. I mean, we all see those ads and things that sort of, play on this idea, and parents will just be, making it up, which is, not once again giving good education. I there was some ad on TV. Anyway, I'll digress. You can get rid of that. I think the thing that we have to talk to young medical practitioners about is actually overcoming that. So learning, getting decent sexual health education, knowing it, and not being embarrassed to ask about it. So, and then learning how to talk about it. So it's one of the things that I do when I'm teaching the medical students is we have a session on sensitive communication. And so if you can talk to somebody about sex, then you can probably talk to somebody about most other things, excluding dying. It's very different. But we've got to start getting people to be able to have these conversations, and most people like to, ignore them. So one of the things I always say to the medical students is, what is the area of medicine that sexual health doesn't come into at all? And I'm yet to be able to, they give me a response, and I'm yet to be able to not tell them how I think sexual health is involved in that area of medicine. And that sort of stops them and makes them think, yes, because the majority of their patients will be sexual beings. So if you're having treatment for cancer and you've got a partner, people don't even know whether things. So, that kind of, am I going to hurt them? Am I going to, and so there's lots of kind of issues around that. So at CERT, the Centre for Excellence in Rural Sexual Health, a large part of our work is increasing workforce capacity. So we're actually not only teaching health practitioners and rural health practitioners, basically that means that we want to increase the understanding of health practitioners of what sexual health care to provide, but also how to provide it. So that's having the conversations and how to make access for younger people easier, how to, make your clinic look like you want to have people in there who discuss all different aspects of sexual health. Having a little rainbow flag or a transgender flag on the door of your clinic waiting room can speak volumes, and they're tiny little kind of credit card size stickers, and it just sort of says you are all welcome and we're able to have these conversations and we'll help you.
So medical professionals are trained in how to communicate to the LGBTQIA+ community?
I think, yes, and medical school is very different from when I went 10 years ago, and they're getting, medical students are getting much, much better at communicating, but also reflecting on their communication styles and constantly learning. I think this is one of the really big improvements in healthcare education, is teaching people to reflect on, how they're communicating, what they're doing, all parts of medicine, and that becoming a normal part of their medical practice. So no one is perfect. No one's going to do everything exactly right every single time. But when you do, put your foot in it, make a mistake, you apologise, you learn from it, and then you try and fix that up, whatever that is. So I know at Melbourne Uni, in the Department of Medical Education, there is, focus on those sorts of aspects. So communicating with people from the LGBTQIA plus community. So we're getting there. We're not perfect, but there's at least some attempts to do that. And just talking about community, particularly in a rural area, or people from those broad communities, is that we do know statistically that they are people who are LGBTIQ plus at more risk rurally, just because of isolation.
Yeah.
And so getting communities to understand that, I think, is a really big, so we've got to shift that community or societal attitude, which is shifting, so things, but it probably happens all too slowly for all of us, but things are happening. I think we're heading in the right direction.
Yeah, I definitely think for the sort of LGBTQIA plus community, having internet access is probably a glorious thing for people in rural areas, where you can suddenly connect and see people who reflect your same values and, share your experiences, and that you can actually reach out.
I have to say, at SERSH, we have every second year, although COVID's sort of got in the way of that this year, but it'll happen again next year, we have the Sex Rurality Conference. And so that's a gathering of particularly rural people coming together to, discuss their research or what's working well, and that's a really well attended conference. And there's lots of fabulous work being done in and around Victoria, and we sometimes have people coming from interstate to explain their programs as well, and they can be through all different sorts of things, having local dancers. There was one bit of work presented where someone went and got men to come in and learn dancing, and then they'd also, have discussions around sexual health and sexual violence and intimate partner violence and stuff. And it was all through gaining trust and people who, wouldn't normally go dancing, going dancing and learning to dance. And it was a fabulous project.
Yeah. Yeah, I know Minus 18 does a bit of work in rural areas around LGBTQIA plus community, and, provides access to things like queer proms, queer formals, get together and have that celebration, and realise that sexual health does cover off on so many different things, as you mentioned before. It is connected to your mental health, respectful relationships and prevention of violence. There's so many different elements that sexual health covers. So it's really important that we see it as this holistic thing, and that the whole community recognises that we need to get behind these communities to make sure that they can have safe, happy lives just like other people.
Exactly, because they are just part of the community. There's nothing that should be setting them aside, really. So
absolutely, particularly when we think about suicide rates being higher in rural areas, and then obviously once again higher in the queer community. That's definitely an area that we should be focusing on and supporting within our schools as well as our healthcare systems, I think.
Yeah, and I think, you'll find really good supportive pockets in rural communities, but I think it's getting broader. I think the understanding is there, and I think, our sort of work on this sort of stuff at SERSH is really helping. We've got some fabulous projects going on, not they're not my work, but, it's overdue.
And I think that flows really nicely on what are you aware of that's available for young people in rural communities that can improve their not only access but awareness of sexual health?
So I think it's really important to try and find the right practitioners. I also know there's the, what are they called? The Doctors in Schools program. And so that's kind of increased the access for school students obviously in the government schools where the doctors are, but they do information on, they do updates and professional development on sexual health, but most of them are pretty au fait with sexual health because that's why they're there. But the last meeting that the Doctors in Schools service had that I attended and delivered a in-service on sexual health, they were saying, and this is particularly with COVID as well, that a lot of the students are coming to them for mental health stuff, not just the sexual health. So that's a really big, area of medicine that needs to be concentrated on for young people. So there's Doctors in Schools programs. There are different community centres and things. I'd have to say, as we were talking about before, the parents, guardians, trusted adult members, friends, they're all really good supports for people in the country. What else?
Great. I guess what are some other valuable resources and areas?
Oh, resources. Yeah. Look, what as you mentioned, the internet is not all a bad place, but I think one of the ways you need to get trusted information. And so I guess that's sort of going to some of the main trusted places. And, Search obviously has a lot of links on their website, but Melbourne Sexual Health Centre, Family Planning Victoria or New South Wales, these sorts of the legal aid people have it used to be called Youth Stuff, but it's changed its website, but that's all really useful information. And I think it's not allowing yourself to go down the rabbit warren of Googling things, because I'd have to say in sexual health, people can come in and see me really frightened because they've got onto the internet and they think that they've got something. So I just sort of say be careful and try and get good information from trusted sources. So you can ask community health centres or nurses, or you could, look up some of the websites that I've just mentioned and they will sort of direct you into places depending on what you want information for. We know that trusted information comes from GPs, parents and friends. Just make sure that you're getting it from friends that know what they're talking about. Yeah, so I think that's other good resources, and then see what's going on in your local community. I mean, we've done a project in quite a number of local governments to put in condom vending machines for young people so that they are easily accessed, relatively cheap. And the vending machines pay for themselves now, and the council just keeps the upkeep of it, keeps them full. I think one of the other things is, which I kind of railed against when they first came in, was the automatic checkout at the counter, but that's really increased condom sales where people don't have to take their condoms up to a person to pay for them or request them. Yeah, I think those sorts of things are good resources. There's obviously, if we're talking about contraception and unplanned pregnancy, there's 1-800-MY-OPTION. So that's an advice line that can help people with getting them into the correct care for an unplanned pregnancy and the need for contraception.
Yeah. Another one that I've come across that I think is pretty fantastic is Scarletine, and they have really great resources on all kinds of different things, focused on sexual health, but, looking at that holistically, so including respect for relationships and mental health. And they have a service where you can type in if you have a question and get somebody to give you an answer who's a trusted professional or someone who's been trained in that area. Nice resources.
Yeah, I know there used to be a resource for family planning that was very similar to that. I can't remember what that was called, but yeah, I mean, those things where you can write in, and it's all about building people's confidence to make the right decisions, I think.
Yeah. And I think like empowering young people, like you were saying before, you know, your friends can be a great source, but you know, you can formalize that through peer, you know, sexual health networks where you get somebody to provide some training to the young people, and then young people can go and share that information that they have and share the knowledge and skills that they have, and you can really build a community within your school, whether that's in a rural or urban area. And you can you know, have queer collectives as well, and get out there and support, you know, queer or gender diverse people. There's all kinds of things we can do to be allies to each other and to improve our own skills.
Yeah, definitely. And it's why, you know, the sexual health education in schools will only be really brilliant when you actually have people providing it who actually really want to provide it. So a lot of the time it gets stuck on the PE teachers. This is slowly changing, but, you know, it's something that you need to be taught this stuff by people who want to teach it, because then they're open to it. I don't mean dragging in people from the outside, but, you know, being taught by educators who actually are specialists in this and they've done it. You know, it could be the maths teacher and they've done another, you know, education, or they've done some professional development so that they're good at teaching it. And I'd have to say the other thing is supporting parents to support their kids. And sometimes these conversations are really awkward because the adult doesn't think that they know they've got it covered, but you're an adult. And I think that's part of the responsibility. You need to put your big people pants on and find out about it with the young person, or find out about it and get back to them. Never have a conversation that starts with, I'll get back to you about that, and then never get back to them about that, because that says to the young person, we can't talk about this. Yeah. It's the same as my other, you know, soapbox thing is calling anatomical private parts or genitals by their incorrect terms. So we need to start, you know, owning the words penis, testicles, scrotums, vaginas, vulvas. Please learn the word vulva. Your vagina is not on the inside and the outside. The vulva is on the outside. The vagina is on the inside. But start talking to your kids because the moment you start using euphemisms for your genitals at the age of whatever it is when kids can first talk and things, is the moment you're telling them that their genitals are taboo.
Absolutely. But,
yeah, and there's not just one talk. There's multiple conversations, but that's probably in younger kids than what you're thinking about. But then you will have people who listen to this who are either parents already or going to be parents in the future, or they're going to be the world's best aunt, uncle, whatever they're going to be. You know, they're going to be an educator.
Yeah. And I think young people can also be really great modelers for their parents or older relatives or friends who might be sort of new to this whole new world, and a lot of the discussions that we're having and a lot of the terminology that we're using is shifting quite quickly, and I think we can recognize that young people can really, you know, lead the way and model that to their people around them. You know, I'm using this term, this is what it means. And I guess being sort of open to learning is and open to that curiosity is so important, and understanding that just because they're older than you mean they've had the same experiences or exposure that you've had. Taking that journey and not sort of forcing it on people, but really taking them with you, listening to what they think about it and sharing what you believe about it is really important.
So often, if I've done parent talks, you know, I'll talk about if someone wanted to, and this is very middle class, if someone wanted to buy a house, you know, your kid came to you and wanted to buy a house, you'd go to the bank with them and you'd find out what the best home loans were, and you'd make sure that, you know, you'd go along that journey. If we want to remove my middle class values from that conversation, you know, there's any other sorts of education, technology. I mean, boy, you know, young people know technology better than us old fogies. And so taking that journey with them to learn about something and be able to, you know, communicate with people people. And that's been really important over COVID because, you know, a lot of older people have had to upskill so that they can have conversations over Zoom things. So there's lots of aspects of, you know, our lives that are changing constantly, and we, you know, can learn together. It doesn't matter how old or young we are, hopefully.
I think that's such a lovely message to people. I'll just open this up in case you wanted to add a little bit more, but is there another way that we can support young people in rural areas to have fun, pleasurable sex lives?
Well, I think education is the main thing. And as you were talking about before, respectful relationships, having good self-esteem. Once people are educated and they make decisions, good decisions for themselves, whatever that may be, we find that there is very little regret. And when you have less regret, you tend to be, you know, happier about where you are, and therefore you're able to enjoy yourself more. And I think there's always at least two people in a, you know, if you're having a sexual relationship, you don't have to have sex with someone else. You can have sex by yourself, I suppose. But if you are having sex with someone else, there's always two people, and both people need to be mindful of each other. And then, you know, when that happens, you tend to have better sex. So, and that's what people are, you know, if you're going to do something that's fun, you may as well make it as enjoyable as it possibly can. And I think that goes for all people. But if we stop treating it like a taboo subject, then people won't have to scurry around trying to hide it. And, you know, if we can acknowledge that most of us enjoy it, then it's probably a better attitude to take on to support our young people. That the reason that they want to do it is because it's seen as fun.
Mm-hmm.
It's a good thing. It makes them feel good, makes us feel good, so it makes them feel good. So that's why people are doing it.
Yeah.
You know, I often, you know, think of if you took away the heat of the moment in sexual activity, I wouldn't have a job. We'd all be very, very bored. Like if we were all so responsible and whatever, we wouldn't just be pushing the boundaries and having a bit of fun. And that's when you're an adolescent, that's your job, is you need to actually push some of the boundaries, but you need to know how far you can push.
Mm-hmm.
You know, how high is the cliff you can jump off without hurting yourself. So it's the same thing as you don't want to just go, oh, I can take any risk that I want, but it might end up either, you know, A, killing you, B, you know, changing your life in a trajectory that you don't want to be.
Yeah, I love that message for everyone listening today. Dr. Siobhan says, go out and have pleasurable, fun sex lives.
Yes.
Thank you so much.
Safe ones as well. Safe. I'll get locked off the sexual health physicians chapter of medicine. safe. Yeah.
All right. Thank you so much for talking to us today, Dr. Siobhan. I really appreciate you taking the time, and I think you've really outlined some of the really important issues facing young people in rural areas, but also just generally, and I think really dispelled any fears about going to see the doctor. If they're half as lovely as you, Siobhan, I think everyone will be in very good hands.
Oh, thank you, Grace. You're making me blush.
No worries. Thank you very much.
Hey, no worries.
Hi, everyone. I hope you are enjoying the Eggplants and Peaches podcast. I'm here to tell you about another podcast called Youthology, Navigating Life as a Youth. This podcast is hosted by me, Inda Johannes, and is all about the issues, experiences and fun that is experienced by youth. I talk about a range of topics and have special guests and friends joining me for some episodes. Listen now on Spotify, Apple Podcasts, Google Podcasts and more. I hope to have you join me soon.